what led me to get tested was first year medical school, period was for 2 weeks, wasn't stopping, and I started having symptoms of anemia that I now know.
Yes.
So I was weak, tired, lethargic, and sometimes if I walk certain distances, I was short of breath. That's when I went to my family practitioner, and then he went, okay, based on what you're explaining, you might need to go to a gynecologist. Never been to one before in my life. And then when I went to her, she just goes,
The information shared on Everyday Period is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions or concerns you may have regarding your health or medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this show. Your health is unique and only a medical professional can provide personalized guidance. Everyday Period removes the stigma, the mystery, and awkwardness from reproductive health and introduces real empowering conversations to create a greater understanding. Hi, I am Shelly-Ann Weeks, the Period Lady, and I'll be your host and guide as I navigate you through the murky waters of all things reproductive health. Are you ready? Let's normalize the talk, celebrate the experience, and make periods something we're proud to discuss. Welcome to the conversation. I want to hear from you. If you have any questions or comments about the topic, or if you have a question about reproductive health generally, send us an email at embraceherflow@gmail.com. You can also like, share, and subscribe to our channel, Period TV. And just remember, we are here for you. Everyday Period is brought to you by Herflow Foundation, empowering Jamaicans one flow at a time. Everyday Period is an AP Rod production. Follow Herflow on Instagram, TikTok, LinkedIn, and Facebook at Herflow Foundation. And visit our website at embraceherflow.com. Don't forget to subscribe to our newsletter. Okay, so today I'm so excited about our guest who is a full-on medical doctor. Yep, she went to medical school. See, I can't even talk. And in the whole thing. So of course, I'm sure she's gonna have some great insights as to why our periods are so periodic. Welcome, Dr. Kimone Young.
hi, thank
to
you,
our
Shirley.
set.
I'm very happy to be here. I'm so excited.
Of course, I'm so excited. We met on the set of CVM's
We did,
Round
we
the
did.
Table,
Yeah.
and we had very, very good conversations. I
We
said, you know
did.
what? She needs to come to Everyday Period.
Thank you. I'm so honored.
Oh my goodness! Obviously, we made a good call there. But you know what? Before we get into the periodicity of it all, let's find out about your period. Can you remember when was your first period?
Yeah, my first period was when I was 12. I was with my family overseas, and it started with brown spotting. I remember being in the bathroom, and I looked on my underwear, and I was just like, that's weird. Mom, and she just goes, oh, wow, Asuko. I was like, okay, I guess I'm in trouble now, because what was that reaction? When she came back, she sat me down and she explained, she's like, okay, this is your period. Usually doesn't start like this. It's usually bright red. Not sure. She wasn't aware at the time why mine was brown.
Right.
But then it started with just that spotting for a couple of days, on and off. And then I think 3 weeks after, that's when I got a full-blown period with a lot of pain.
Oh, tell us about
Yeah.
that. What do you mean? What kind of pain did you feel?
It was that was cramping. That was just continuous. It never stopped. Even if I took Panadol, Baralgin, Voltaren, all of them, it just continued. And then my period came for like 10 days straight when it just started, and then it would not come again for like 4 months, and then it would come back again for like 2 weeks again, and then disappear. So like I had a period between the years of 13 to 18. I had a period probably 3 times for the year.
Oh, that is interesting. But I know usually when your first period starts, you don't necessarily get a regular flow right away. But for it to spread out like that is concerning.
Definitely.
I guess you know why.
So now I know why. I was diagnosed when I was 20. Of when I started medical school, you got a little knowledge and they said, oh, this is definitely not abnormal.
Yes.
I was diagnosed with polycystic ovarian syndrome, which is PCOS, and that's when she was explaining that everything that I had experienced was because of that.
Okay, right. So just for a little bit of context, having irregular periods over an extended period of time is something to be concerned about, because once you start having a period, it's supposed to be a monthly cycle.
Thing,
But if you find that for the year you're only having 4 or less periods, even 6 or less periods, that is something for you to be mindful of and to speak to your doctor about, because it could be a symptom that something more is going on. So tell us, what has been some of the symptoms that you noticed before you even got diagnosed?
Okay, so one of the biggest symptoms for me was that I had excessive hair compared to other females. So my legs were really hairy and I had chin hairs, and it was very uncomfortable for me. But that was one of the things that stood out to me. Acne was really bad for me as well, and I'd get a lot of pain with my periods, and because they would I'd not have them and then they come. That was also weird to me, because what I learned in my biology cycle is it's supposed to come every month. And then my dad was somebody who made sure write it down on the calendar, and he's a very stoic gentleman, you know. So when he'd come and stand up in front of the calendar, and he just goes, "You're missing some." I was like, "Yes," because it didn't come.
I love that.
You know?
Let me just dig up. Mr. Young,
yes,
dig up your entire self. I really appreciate that, because I try so hard to get fathers to be interested in the periods of the women that they love, their children, their wives, just the women who are around and the women they care about. And I think that it is so important that he is able to help you figure this thing out. So big up, Mr. Young. Love that. So you noticed that you had irregular periods, and you noticed that your periods were very heavy. What led you to get tested?
What led me to get tested was first year medical school. Period was for 2 weeks, wasn't stopping, and I started having symptoms of anemia that I now know.
Yes.
So I was weak, tired, lethargic, and sometimes if I walk certain distances, I was short of breath. That's when I went to my family practitioner, and then he went, okay, based on what you're explaining, you might need to go to a gynecologist. Never been to one before in my life. And then when I went to her, she just goes, easy peasy. It was such a relief to hear that, but to also understand that when you just don't know something, and then you go to an expert and they just go, no, this is a simple thing. It's common. It's not as uncommon as you think as you think it is, and you're not alone in it. So that's when I was diagnosed, after that week and a half, I think, of just bleeding and then symptoms of anemia, and that's when she diagnosed me.
That's so amazing that you have that experience, but I'm sure you probably heard that for a lot of women, being diagnosed with PCOS does not happen so easily.
It doesn't.
Sometimes it's years of just having all sorts of unexplained symptoms. They just don't put all the things together. But the fact that you were in medical school at the time, I think worked in your favor, because you were able to put the symptoms together. Because a lot of people, they go through and have irregular periods and just are happy that no period not coming. It's like, oh, no period this month? And I'm not pregnant? Jackpot! Meanwhile, that is just a demonstration that something is actually going on in their system that's causing them to miss their periods. So now that you know, what have you been able to do to help your symptoms or to help you cope?
Okay, so when I was just diagnosed, I went the medicinal route. So she gave me oral contraceptive pills so that my period would come regularly.
Right.
I had started for a year, then I stopped, and I tried to look and see how long my cycle was. So a usual cycle is about 28 days. My cycle was 35 to 40 days. And then I was like, okay, but I want to continue because of the unpredictability of my life and the job that I have. So I said, okay, I'll continue to take that. But I was very overweight for my height. So I was 174 pounds at the time, very chunky, chubby one. And then when I recognized that my symptoms of the male hair pattern as well as just the cramping was getting bad, I decided to lose all of that weight. So I went from 174 to about 130 thereabout. Started working out at the gym, drinking a lot more water, and I was very conscious of what I ate. Anytime my gut or my belly just rejected food, I just went, okay, no, we're not having this. I cut out a lot of carbs, and it stuck mostly to protein, fruits and vegetables. And I recognized that with that, I felt better. My mood swings as well that had happened, they became much more manageable. But I still continued with the pills just because of my life. But losing the weight, I realized I felt more confident. My mood swings weren't so bad, and the cramping, there were a couple periods that I was just like, this can't be a period, because I didn't have pain. I was
no pain
like,
at all.
is this what it feels like to just bleed free of
Wow.
Yes.
Yeah, isn't it awesome?
So awesome.
Yes.
Like you just go, okay, cool, I have on my pad, but no pain.
No pain, yes.
And no pain. It was so good.
Trust me, I can relate to that no pain thing. I went from 11 days, very heavy, very painful periods, to 3 days, completely symptom-free periods.
What?
So listen, my period starts Friday, by Monday, I'm good to go. No problem, no issues,
And then when I started,
nothing.
I had like a bunch of clots and thick and heavy.
And they're not, clot who? Clot where?
Clot where?
Yes, man, trust me.
Clot where?
But you know what you did, what you described that you did is that when you changed your lifestyle, you help your body regularize.
Yeah.
And that is a very, very big thing, because a lot of people don't understand that some of the things that we are doing is causing us to feel some of the discomfort that we feel with our periods.
Yeah.
And trust me, that is a lesson that I learned the hard way, because I cut out a lot of things where food is concerned too. And I changed my diet completely, and I'm exercising and I'm doing all the things. And I'm reaping the benefits of that. So really, a lot of the symptoms that we blame period for actually comes from what we're doing and makes our periods worse. So that's really good that you had that experience.
What I noticed, and what I've been telling people, because some persons who know I have PCOS will look at me and be like, well, you look nice, you lose weight and everything. And I said to them, I was just like, PCOS is also a lifestyle disease. What I've learned is PCOS is usually the precursor to diabetes
I was
in
gonna ask you
women.
about that.
So when I changed my diet, took out the refined sugars and all of those carbs, to me, it was me saving myself from that diabetic end goal that can happen. But it just goes to show that insulin resistance, which happens with PCOS, is because of a lifestyle.
Yes.
So if you lose the weight and you adjust your diet and limit your stress, you will definitely reap the benefits of that.
Said the limit your stress with so much emphasis a while ago, because listen, that stress, do not underestimate how much of a role stress plays in enhancing the symptoms that you have, in just amplifying the pain and making everything else so much more difficult, because stress has a physiological response.
It really does.
Watch what I tell Dr. Bobadi. Come on,
it's
doctor.
True. Stress, you have a stress hormone. It's called cortisol, and that same hormone is what is activated in diabetes, especially when you're sick. So limiting your stress reduces the amount of cortisol in your body, and therefore the cascade of events that happen in your hormone that your body naturally does will not happen. So if you have stress, eliminate it or manage it, because some stress you need, let's be honest, some stress you need to be able to go where you want to go in life. But if you limit and manage your stress, you will fare better.
I have some advice on how to get rid of stress. Stop talking to that person there.
Left the boy.
Don't call him back.
Left the boy.
Don't make it tricky, because the timing didn't make you feel good. We know it go. Enjoy the orgasms. And don't call him back. Even though it's not man alone cause stress.
It's true.
Right? Some woman cause stress too.
Agreed.
Because have some friends who are not really friends. They're just there to take your things and eat your food. You know them. Stop make you come in your yard. There. See, we deal with the stress. So back to So let's talk about some of the challenges that a lot of women with PCOS have as it relates to infertility. You know that for a lot of women who have PCOS, fertility is a real challenge. I don't know if you're interested in having children, but what have you noticed from a medical standpoint as to what can they do to help them if they want to go on that journey with PCOS?
Okay, before I answer that, I will relate to this question, because when she told me about it and I started getting older, I was just like, boy, any person I talk to now, we have to let them know, I might not be able to bear you children. And that's not a conversation. And I recognize how much that does play a part on our minds. So men out there, please be conscious of these things. When a woman tells that they have PCOS, they really think about the infertility or what would happen in PCOS, which is subfertility. They're not that you cannot, it's lower and it's harder as well to get pregnant. My gynecologist, love you to bits, she pretty much had explained to me that changing my lifestyle, losing weight, and as well as trying to track my periods outside of the pills would be good for me to get pregnant. So what I have noticed is persons who take a stock of their life and are intentional and diligent about their diet, their physical activity, and also timing of sexual activity, they are the ones that fare better in terms of being able to conceive. I've also seen miraculous situations where persons were told you will never be able to conceive because you have polycystic ovaries. Because remember, yes, I don't personally have the cysts on my ovaries. I only have 2 out of the 3 criteria. But there's some persons who have very large cysts, and the large cysts make it difficult for them to conceive. But I've seen where persons were told you'll never get pregnant, and some miraculous way they probably stop taking the pill that 1 week and next week they're pregnant.
You know, honestly, the things the doctors need to stop doing that though. They always go make some never declaration.
Oh, I agree.
Because the human body
is dynamic and it's individual.
I've seen women have children after menopause.
Yes.
So the human body just kind of does what she wants to do. You know, so for you to say with so much confidence, oh, you will never.
You should caveat.
It has been proven wrong so many times.
It has.
I think you should just say, well, you know, it's highly likely that you probably won't be able to.
Agreed.
But I don't know if we should go straight to never.
Never. But there have been persons have told me, that doctor told them that they will not get pregnant, and 2-3 kids later.
Yes, man. The body finds a way. It will.
When it's time, the body knows it's time. I've also been told that.
Yes, the body knows it's time. Back to that stress point. Some of the times when people are trying to have children, the process is very stressful. And you know, you realize sometimes that whenever they stop and say, all right, look here, this thing you're not working, we could just say, all right, it's not in our destiny to have children together, and then they stop trying, and before you know, them do the style and turn upside down and drink some rum the night there, and you know, it was a happy new year, and before you know it, September boom, it's a September baby.
Yes, it's true,
right? So sometimes it's the stress
that wanting to conceive that makes it more difficult.
Correct.
Persons have said, you know, when you want it really bad, you don't get it, and when you relax, it just come to you.
In other words, wanty, can't get it, and getty, no want it. Thanks to Jamaican vernacular, we've got a saying for everything. So
it's true. We have a proverb for everything.
We've got a proverb for every situation. Yes. All right. So, what would you tell if you, with everything that you know now, all the lessons that you have learned? Tell me, what are some of the things you wished you knew and that you have learned that you can help somebody else with since you've been going through this journey?
When your period comes, drink at least 3 liters of water every day.
I've been telling them that.
3 liters of water every day. I wish I also knew that despite the pain you feel, exercising actually helps to reduce your cramps. What else would I have loved to know? Your parents may not understand, but you can find somebody who will, because that was very big for me. Always go to a medical doctor. The answers you're looking for, they may not give you the answer you want, but they will provide you with more information that can help you gather knowledge to find the answer. Fruits, vegetables, you don't need a Burger King. You're going to crave it. Let's be honest. You're going to crave it. You're going to want it. Are you going to want the KFC barbecue and them don't have it, right? So eat better. Eat better.
Bite the carrot and think, ooh, chicken.
Like I recognize once I took out all those excess fat, excess oil, excess carbohydrates, I felt so much better. Less pain, like genuinely less pain. And my pain used to have nausea sometimes as well. So water, diet, go to a medical practitioner, find the community that's able to assist you. There's so many communities available online now. Look it up. PCOS communities are there. Period poverty communities are there. Find them. Endometriosis for those who might have it. Adenomyosis for those who might have it. Find the community.
Talk to each other.
Talk to each other. Business. Tell your stories. Tell your stories.
Yes.
Because chances are another woman has gone through it and she has found ways for herself that might be beneficial to you.
Yes, and I'm happy for that point, because that's the reason why we're doing this. We're doing this because we want to share those gems. We want to share the lessons. You don't have to go through it all by yourself and only learn from your own experience. You can learn from the experience of somebody else, and that will make your experience less painful and give you some tools that you did not even know existed. So let me get into your doctor hat now. Put on your doctor hat now. So
I thought I took it off.
no, you have to put down about it. Just a little tips, right? So we have a lot of young ladies right now who are going through very difficult periods, and we're even seeing young ladies having younger, like they're having their periods at younger ages, and you know their parents are like, Lord Jesus, I'm not never ready for my baby start a period yet, and all these kind of things. How do you advise those parents whenever you know they get to the age group where they're saying, no, she's too young to know about them someday, I want to wait? Personally, I say, listen, tell them the whole thing, they'll be fine, they'll understand. But what do you say to the parent who needs to talk to their children about periods? And I say children because I'm thinking boys too, who needs to talk to their children about periods and is hesitant to do so?
Confront the hesitancy and go through it. Still have the conversation with them, but what's most important is that once a period starts, that's when puberty starts. That's when your emotion also starts. So whatever you say to them at this point, they will remember going forward. So be open, be welcoming, be loving as well, and have the conversation. If you don't believe you're equipped to have a conversation, invite somebody who you think can have with them. If you don't think you have the knowledge, you don't have the skills, you don't have the emotional patience, carry your child to somewhere, a guidance counselor, a doctor, the school nurse, a friend, and sit down with them and have the conversation. Don't run away from it, because if you run away from it, your child might figure it out by themselves in a more damaging way, and you wouldn't want that. So I would say, if you are hesitant as a parent and you want to discuss reproductive health with your children, confront the hesitancy, work through it, and remember that that is your child whom you love. So that's what I would say.
Yeah, man, and I echo that, and I also want to say, do not take yourself out of the conversation. Sometimes the parents are so busy being disciplinarians that they take themselves out of the conversation by silencing the child before they even get a chance to express themselves. They probably don't have the words yet to express exactly what is happening, so they're gonna fumble it, and in fumbling it, they might say something that you think is offensive. You can handle that by addressing the offensive thing that they said, without shutting them down and let them know that you are not the one to come to witness. Because let me tell you something, they're gonna find out, and they might go to someone who might use that as an opportunity to manipulate and to take them for granted and to put them in danger. You want to be a part of the conversation. You don't want your child talking about all of these things with them little friend who don't know nothing either, and you are left out of it, because they will leave you out of it. And I'm talking from the experience of somebody who never talked to our parents about nothing, because I knew I couldn't. Right? So y'all know, right? They can shut you out of their conversations. You don't want that.
You don't want that. You don't.
Yes, ma'am. Well, we are here with our good friend, Dr. Kimone Young. We're talking period stories. We're going to take a little break, but when we come back, she have to ask the period lady something.
Okay. All right. Love that.
Everyday Period is brought to you by HerFlow Foundation. The HerFlow Foundation is dedicated to improving menstrual health and addressing key social issues affecting women and girls in Jamaica. Through advocacy, education, and direct support, HerFlow works to break the stigma surrounding menstruation and empower women to live healthier, more fulfilling lives. HerFlow's flagship project is to end the period poverty in Jamaica. Since inception, HerFlow has donated over 9 million menstrual products to Jamaicans in need. To learn more about HerFlow, please visit embraceherflow.com. So we are here with our very good friend, Dr. Kimone Henry, and we've been talking period stories, and she said she had a story to tell me. I want to hear it.
Okay, so the story I have that was traumatic for me and not understanding that I had PCOS at the time was when I was 19 and my period went away for like 4 months, and my father kept checking, and he's just like, usually it goes away for 3, it's now 4, and it's heading to 5. And I was like, yes, something is wrong. Let's figure it out. Daddy said, I soon come. And then he came to me with a pregnancy test. And I was just like, what is this? He's the pregnancy test. I said, but I'm not doing anything. Yes, but the period's been gone for almost 5 months now, so you need to do it. I go to church with you every Saturday. I sing okay, all right. And then I said, hey, when I take this pregnancy test and it comes back negative, are we going to go to the doctor after that? Yes, ma'am, we'll do that. I said, okay. And I remember the gut feeling of going and taking the pregnancy test.
You did nervous, I no say never do nothing.
No, but like, because I felt like I was in trouble. Like, why my parents don't believe me? I felt so bad. I'm just like, why are you pushing me to do this? And just take me to the doctor and done. So I do it and it clearly came back negative. And then I was like, so going to the doctor? No, man, you're good, man. Huh? Okay.
He just wanted to make sure that he didn't have to deal with a certain thing. You can imagine how all him relief, all him at, when he in the bathroom, I freak out, to you, don't feel away, you know?
And then the flip side is when it happened again when I'm now in university, I was trained. Okay, when it goes away for almost 4 months, buy a pregnancy test and take it because the first time, that's what they told me. So I did it. So when I presented my father, hey, it happened again, and I did the pregnancy test and they was negative, so why you do it for? Sir.
You must have been going on with something.
Sir, that's what she did the first time.
You're trying to trick the man.
That's what she did the first time. And I didn't want to have to hear it again, that I must do it. So I eliminated that by myself. Just goes, oh, okay. Say come back negative, so what now? I went to the doctor like you were supposed to do. Oh, what the doctor said no. Okay. I love you still, but that's all right. Yeah. Well, that's my story. I remember it to this day. And then when they told me I had PCOS, my family was like, no, so. Just eat them food here. It's a little thing with the testosterone. Just eat those foods and you're all right. And I was like, it's real, guys. See my notes here? I learned it in school. So the doctor that told me it's in the book. It's not real. It's all in my head. Okay. All right. But they were able to come around after a while. And I can now fully confidently say I'm a PCOS girly and I'm a PCOS survivor. And you can really have a good life with PCOS. You don't need the metformin. You don't need medications. I hear spearmint tea is really good.
Yes. Well, you know what? Big up Mr. Young again. Yes. Mr. Young. Well, I have a father story. Oh. My father used to go into the pharmacy and read anything when you see the word vag. So all of the brands that may have vag, you read it, and then you buy a powder, you buy a spray, buy any ointment or whatever, and then come say, hey, see a pum pum powder here, or see a pum pum spray here. He introduced me to the FDA spray, feminine deodorant spray. Yeah. Because him see the spray and him stand up and him read it and him say, oh, so this make a pum pum smell nice, all right. And him can't come and say, see a pum pum spray here, and
that's so cute. He's like, this is somebody who don't know anything but them a try. And you just go, thank you.
Yes, so Mr. Weeks did that. Mr. Weeks did that. But I just think that it is so important for men to be a part of this conversation because you see how much of a difference they make, especially to their children, whenever they participate, whenever they know what to look for. And so that is why I am on a mission to get more men.
So speaking of mission, tell me what community in Jamaica you think really needs help with period poverty.
Every community. I've not gone to a community yet that doesn't need help with period poverty. People ask me that question about school. They say, Shelly, so which school you got to? And everything is fine. Every school I've gone to, I do it on purpose. I do two things when I go to a school. I speak to the school nurse and our guidance counselor, and I ask to use the bathroom. And I don't want to use the office bathroom. I want to see the bathroom that the girls use. And I do that because I want to see what kind of condition their bathrooms are in. And what I realize in most schools, from Kingston all the way back to Westmoreland, is most of them don't have even a tissue. And some of them in the country mostly don't have running water. So what they'll do that they'll have like a drum and they catch water in the drum and there's a bucket for you to flush the toilet. Right? And then when you go to the schools, the bathrooms are, you see the little sanitary bins that everybody talk about disposing the sanitary bins. And that's why I have all discussions about how to dispose the pads. Lots of the schools don't have sanitary bins. Okay. So I get complaints from teachers who would say, the girls don't want to use the regular bin. So what they would do is they will hide the pads, their used pads, they'll roll it up and all of that and hide it in little corners and crevices in the bathroom. And of course, the poor janitor goes in there to clean and smelling that smell and have to find the smell and it's a whole issue. So I can tell you right across Jamaica, in every school that I've been in, there is an issue with girls not having access to menstrual products. And the teachers can tell you because they'll go to the teachers and they'll ask them. Haile Selassie, hi, Mr. Rickman, he's the guidance counselor at Haile Selassie. And he tells me that when he goes on vacation in the summer, if he's traveling or whatever, he buy pads and bring back. Nice. So when I went there to donate the pads, he was like, yes, we need this because it's something that he would use to do. And he's not the only one. Other guidance counselors, once a month, they'll go when they get paid and they'll buy products. And of course, you know, teachers don't make no money, so they can't buy products to serve all the students. And so that is how you end up with the girls getting one pad from the guidance counselor. Because if you buy 3-pack, you can get several pads, you can get one. Yeah. So you get your one pad and you try to make the one pad last. So they end up wearing one pad for several days. And that is what happens in the schools. But I can't pinpoint one single parish where I can say everywhere. This is the parish where the problem is. To attack that parish, right from rural to Kingston, period poverty is in Jamaica. As a matter of fact, right now, I would love the funding. So, hi, money people! So we can do empirical research to see exactly
where the need is.
The need looks like. I've done research in schools. Okay. And with the research that I've done in schools, about 40% of girls are impacted by period poverty. Okay. However, if they are impacted, so are their mothers. So I don't know what the mother figure look like, and I don't know what it looks like across every single school because I've not been to every single school. So I would like to do that research.
I'd be interested in reading that.
Yeah, man, for sure.
So funding.
Yes, money people. Hi. Hey, everyday period fam. If you're loving these real unfiltered conversations about reproductive health, don't forget to hit the subscribe button and turn on notifications so you never miss an episode. Join the movement by liking, sharing, or dropping your thoughts in the comments. We want to hear from you. Let's keep breaking the stigma and spreading the knowledge. Periods don't stop, and neither do we. Follow us on Instagram, TikTok, LinkedIn, and Facebook at Herflow Foundation. So before we go, Dr. Kimone, tell the people how they can find you.
You can find me at KYMMA_1 on Instagram and TikTok. You might see me doing something called Kim Talks. It's the same person. Or you can also visit me at my private office, 5 Downer Avenue. If you ever need a medical doctor, I can switch hats to help you with your needs. I also do home visits as well, so I'll come to you if needs be.
Oh, yes, well, you need that. Like she come in your yard. Yes, we like that convenience something there now. I'm into that.
Same.
Thank you.
You're welcome.
Oh, this is so much fun. It's over already.
Thank you for my shirt.
Yes. That nice to me?
So nice.
Nice like rice.
Like that.
All right, so one last question I have to ask you before I make you run.
Still?
What would you tell a little girl? She hasn't had her period yet, and you want her to be ready or to think about her period as something that she's going to experience, but you want her to not feel scared about it. What would you tell her?
It is a blessing to have a period. It means you have a functioning womb. It can work. Love it, embrace it. When you love your period, you love your body. And your body will love you back.
I'm going to leave it there. Thank you so much, Dr. Kimone Young, for being on our set this afternoon. And thank you for watching. And before I go, I want to remind you that reproductive health is not just about period or pregnancy. It's about how you take care of yourself physically, mentally, emotionally, even socially. Remember, from puberty to menopause, reproductive health is going to be a part of your life and your overall wellness. So take care of yourself and each other. Support the period sisterhood. Walk with period products and give somebody one if they need it. All right? Until next time, I am Shelly-Ann Weeks, the period lady. I see you. Take care. Walk good.
Bye.
If you want to get in touch after the show, send your questions or comments to embraceherflow@gmail.com. Until next time, remember to like, share, and subscribe to our channel, Period TV. Follow us on Instagram, TikTok, LinkedIn, and Facebook at Herflow Foundation. Our website is embraceherflow.com, and don't forget to subscribe to our newsletter. Thanks to our production team, April and Digital Pro, for the great support, and thank you for tuning in. See you next time. Take care. Walk good.